Okay, everybody, I think that we can start our presentation today. It is 12 o'clock p.m. here in Las Vegas, Nevada. So I do think that we can start right now. So thanks for joining me today in this presentation. This is the first of many webinars that we want to offer in this platform, in this tele-learning, sort to say. And because the COVID, of course, we learn how to reach more people using this kind of technology. And this is super cool because we can do many things in this technology. Basically, what we want to do here in Medidenta is to create an educational institute or an educational and research institute. We want to join people. We want to join researchers from around the world, and we want to join lecturers as well. We already start this conversation and with many lecturers here in the United States and outside the United States as well, to join us in this institute, educational institute, that will be basically a dream coming true for me. My background is I was a faculty member at University, State University in my place in Londrina, Paraná, in Brazil, for 24 years. I was the head of department there in endodontics. I was vice dean as well. And when I came here to the United States in 2012, I joined the Roseman University that was pretty much opening in Utah. And of course, I was part-time at the university, part-time in my formal job in a leader company, dental company here in the United States, doing a lot of R&D and doing clinical affairs as well. Now, we move with all projects, especially the Genius project that we started in 2015, and now we are launching the second phase of this project, that is the Genius Proflex, that we are going to talk in this presentation as well. So nowadays, I 100% focus on developing new products for endodontics and related. We are working hard on education and clinical affairs here in Medidenta, Las Vegas, Nevada. I want to thank especially my colleagues here, the workforce here in Medidenta, and especially Alfred Perez and Sean Ryan, our CEO, our CMO. They believed in this project since the beginning, and they are working hard to make everything happen, including the Educational Institute, that soon we are going to have more and more news about this, right? So let's start the presentation here. I will share my screen. I love this quote from Dr. Rui Hizatugu. He is a Japanese descendant Brazilian dentist in Brazil. He started to work in 1957 in his clinic with endodontics. And what he's saying is about 3% of the whole cases from 1957 to 2020, just 3% were complex cases. And of course, if you open the social media nowadays, you see a lot of cases, beautiful cases with double curvature, triple curvature, a lot of things that seems to be impossible. And people likes to post these kind of things, the big majority with very good intentions, even with the explanation how I got this case done. And this is very nice. I'm not complaining about that, but the fact is 97% or more of the cases that appears in your office are not complex cases, are standard cases, are cases that you can do pretty much with a good protocol of technique. So if you see the cleaning and shaping the root canal, that was one of the most, if it is not the most paper cited on the endo literature, you can see that there's evolution of instruments to get a better shaping of the root canal. But is that the same of cleaning? Well, actually, no. I have a very good friend. He's an endodontist, Brazilian endodontist working in Canada. His name is Dr. Rodrigo Cunha. And he has a quote, a statement that is awesome. He says, the root canal treatment starts after instrumentation. And he's totally right. So you have to shape the root canal. You have to open the root canal to get space to put your disinfectant, to put your EDTA, to put your sodium hypochlorite, to put your chlorhexidine, whatever is the irrigant or the disinfectant that you are using. Plus, with technology nowadays, we can activate, and much more than activate, we can do a more effective cleaning, so to say, but we have to have space. If you have space enough to put your needle, to put your cannula, or to put your ultrasonic tip inside the canal and do the activation and disinfection, it's better. So today we are going to talk about how to open this space inside the canal to allow a better cleaning with our irrigation. That, by the way, I don't like this terminology. We use a lot of wrong terminologies. And the problem of using wrong terminologies is the fact that attach glue to your brain, and then you think that is exactly the same that the terminology means, the name means in the real world, will means in endodontics. And irrigation is one of them. Irrigation comes from Latin irrigare, that is pretty much to transfer liquid from one place to the other. So that's why we use irrigation in our backyard, for example, especially here in Vegas, that is 113 today. So you have to transfer water from a reservoir to the plants because the plants will die, right? So this is irrigation. What we do inside the canal is washing the canal. We wash the canal. We want to provoke this washing inside and remove debris, remove particles, remove pieces of dental pulp tissue. We want to remove everything that is there to provoke this very nice cleaning and declining the infection inside the canal. So next, part 2, that will be in 2 weeks, July 9th, 90th, we are going to talk about irrigation, and we are going to talk about washing the canal after the instrumentation that we are proposing here today. But it is important, first and foremost, to find canals. So a good access cavity, a good knowledge about anatomy and morphology, and where are the canals entrances, this is fundamental if you want to perform a very good root canal treatment. But not always, even with a good access, you can see the canal entrances. And in my opinion, when you use burrs to work in the pulp chamber floor, you are so prompt to do this. And if you see here, you can see that we made a perforation in pulp chamber floor. So you have the canal entrances here and here, but you have a big perforation here. Of course, we are trying to find the canal entrance. It was a calcification, and this is very complicated. That's why the first thing that I want to show you guys is the Sonos. Sonos is a piezo, it's not magnetorestrictive, it's a piezo scalar or a piezo ultrasonic unit that has a lot of features for endodontics. As you can see here, we have 3 bottles, and the reason that we put 3 bottles here is the fact that we want irrigants on these bottles. We want sodium hypochlorite in one, we want EDTA in another, and pretty much still water in the other. Next time, next webinar in July, I will talk about this and about the protocol of irrigation using the Sonos. But one of the tips that I designed especially for finding canals is the trumpet. The trumpet is this little tip here. You see the diameter is 0.70 millimeters, is very, very small. And this shape means that you can go and touch the pulp chamber floor and nothing will happen. So differently than the burr, that when you touch with the burr, you cut the pulp chamber floor and probably you're going to do a perforation. This trumpet cuts laterally, so you can remove easily the pulp chamber sealing or remainings of pulp chamber sealing that pretty much sometimes makes some difficulties for finding the canal entrance. In this video, you can see in a very fast forward, you can see how you can remove easily. See these little pieces that you can remove with the trumpet, and the pulp chamber floor is intact. So it's very interesting, the use of this feature. The second tip of this kit, special endo tips for Sonos, is the Scout tip. The Scout is the smallest tip in the market. It's 0.25, it's stainless steel, 0.25. And what happens is after you use the trumpet, you can find and open a little bit without cutting, just open a little bit the canal entrance using this tip. And of course, you use with irrigation to make to start to clean all this area using not only scouting the canal, but starting to clean something. And again, it's a fast forward video, but now you can see, easily can see the root canal entrances, the polysonic tip. So this is part of the special tips as well of this special kit. And this is for irrigation. And I put this tip right now because after finding the canals, before doing any kind of instrumentation, I like to start to clean these canals with this tip. This tip is very small tip. It's 0.28. The taper is 0.35. So you can definitely, you can clean cervical and middle thirds, and sometimes more than that, without any instrumentation, just using this tip with sodium hypochlorite. So it's very easy. You have a connector, this connector you just buy once, and the tip is a polymer peak polyether cologne. This is a high performance thermoplastic tip. The fusion temperature for this plastic is 350 C. So be very careful, put the tip first inside the canal, and then you start using the tip. Never use the tip outside the canal or activate the tip outside the canal because you can melt the tip. The first thing that I like to do, sodium hypochlorite inside the pulp chamber. I put some RC Prime, that is a lubricant, and then I go with my polysonic tip and see that I'm activating and I'm using a lot of sodium hypochlorite coming from the bottle, coming from the device, doing a renovation of this liquid as I activate the liquid as well. I like the ultrasonic irrigation, but I like the more when you have the sonic stream, that is a constant flow. Again, we are going to explain more in detail about irrigation or washing the canal next time. So this is the kit. We have Medidenta is offering the Sonos with a bunch of tips. This is a special kit that you buy separately. So after finding the root canal, after finding the canal entrance and scouting the canal a little bit, and yes, that is not a perforation, it's a root canal. What is the instrumentation that I need to do? First of all, what is the movement that I need to do? Let's start talking a little bit about instrument fracture, file fracture. This is a nightmare for everybody. And as you can see here in this particular case, I was finalizing, I was giving the final shaping, I was using the final file. And what happens is the file break. So trying to fix this problem was a paramount for me. And especially when I saw this, Dr. Max Payanen, he stated in the Industry Today, July 2004, despite the advantages of rotary systems, file separation remains frustrating and ultra-frequent. And it was true. So what is the most common movement that we do with our hand files? Is the Ramos movement, is the balance forces. What happens is, if you take the movement, the balance force movements, and put in a motor, you have the reciprocation movement. This is Dr. Mario Zuolo here. This is, he is one of the authors within Dr. Gustavo de Deus, Emmanuel Silva, and Eric, and the others, authors of this marvelous book. I hope that soon they come in English. So the definition of reciprocation by Dr. Zuolo in his paper, Journal of Endodontics 2015, was perfect. In short, asymmetric reciprocation can be defined as a sequence of repetitive and imbalanced back and forth rotation movement, which somehow mimics the balance force hand feeling motion. And that is true. So the concept of Dr. Rohn, and it's worthy to say that there's more than 400 papers showing how balance forces are better than any other type of movement or kinematics that you give in your hand file, just to say. So what happens was, when you use reciprocation, and especially reciprocation in motors, you have a drop on file factor tenfold. So recently I saw Dr. Gustavo de Deus showing a very nice chart from Dr. Eric Souza showing the decline, the drop of file fractures was amazing, was tenfold. And in this paper here, the author say the fracture incidence of reciprocating systems range from 0.1 to 0.2, and when you use once meaning just use once your file, and is up to 1.33, and according to Dr. Eric Souza, 2.5 sometimes percent. So dropping from 2% to 0.1, it is something that is extremely important. That's why we put this patent back in 2010 and was granted just in 2017. For many reasons, patents suffer this kind of a competition, suffers a lot. But we put this patent in reciprocation, cutting clockwise to cut, or it was a right cutting. So it means that you have a big angle cutting clockwise, because the rotary files, all the files cuts clockwise, and relieving or releasing the file counterclockwise. That makes a lot of sense. Well, kind of a lot of sense, because if you see one of the files from a leader company here in the United States and the whole world, actually, their reciprocating file cuts counterclockwise, that makes no sense at all. Actually, if you see this paper from Nicola Grandi, he says for commercial reasons, the cutting direction of wave 1 fluid design ITIL is counterclockwise direction, but is clockwise for all other rotary files. And the first paper from Dr. Ghassan Yared was made with a pro taper that cuts clockwise, and he was using clockwise big angle, counterclockwise small angle. So the problem from a commercial standpoint is the fact that if you create a file that is a special file for that special movement, you have to have a special motor as well. And then if you see in this paper, Dr. Sapar, he says there's open motors, there's closed motors. What is an open motor? An open motor is the motor that you can change reciprocation angles, and you can use files in rotation and in reciprocation the same file. Meaning a right cutting file, you cut in a right cutting reciprocation as well. Well, not with the major company motors. If you see these motors, they are closed motors, meaning that if you want to use the super nice reciprocation movement, you have to use their motors with their files. You cannot use your regular rotary file, or you cannot use even the Genius or Genius Proflex files that cuts clockwise instead of counterclockwise because it makes no sense. But fortunately, after a lot of dispute, we were able to launch the first open motor here in the United States. That was the Genius motor. Unfortunately, the Genius motor is not anymore. This motor is good. So if you have the Genius motor and you want to continue to use, you are more than able to do that. I always said, and I see here a lot of people like Dr. Joe Fanagi, he has a lot of these motors, and I will tell you, Joe, you don't need to change your motor. You have a motor that, as I told you in the past, and in my lectures, I used to say that all the time, this is the last motor that you have to buy. And of course, because it's an open motor. Of course, if you want a cordless motor that is open as well, now we have the ACE motor. Medidenta is offering the cordless apex locator built in the motor. And yes, it is cordless and is an open motor. As you can see here, you have a base, so it's a kind of crossover design between a cordless and a bench motor. Because in the bench motor, you have the base and you have your handpiece with a cord. With this motor, you have the base, you have the handpiece without a cord, and guess what? The base is cordless as well. So you have two batteries. You have a battery for the base, you have a battery for the handpiece. There's so many things in this motor. I cannot tell everything today, but we are going to have more webinars. In more webinars, I will explain all the features of this motor. Basically, this is a built-in apex locator motor and motor, cordless handpiece that you can use with your files in reciprocation and rotation, and is an open motor. Meaning that with this motor, you can change the angles. As you can see here, I'm changing the reverse angles, I'm changing the forward angles as well. So increments of 10 degrees. Of course, you don't need to know the angles that you want to use. I'm just saying and showing that this motor is an open motor. We have a library inside this motor, has a file library that you can choose the file that you want to use automatically. And there's Genius Autosense that I will explain as well. What file should I use? Well, as you can see in this little chart here, we started with stainless steel hand files, and then we went to night tie hand files, and then we went to rotary night tie files. What is the difference between night tie files nowadays comparing with the past night tie files? Is so-called heat treatment. The heat treatment is nothing more, nothing less that everybody knows since the Vikings, what you have to do with your knife, with your sword, with whatever. If you want to create a more resistant stainless steel, if you want to create a more resistant metal, you need to do the heat treatment. That is pretty much high temperatures, low temperatures. So you can change the properties of the metal when you do the heat treatment. And that's exactly what we did with the Genius Proflex. Not only that, but we customized the heat treatment for each file size. Because in my mind, I never understood why I need a control memory super flexible heat treatment for a number 1504 file. So basically what we did was customize the heat treatment for each set of files. Again, I never understood why a very small diameter file like a 1504 needs to be control memory, because the file itself by the metal mass is already flexible. So doesn't make sense for me. So I will explain what we did, and you understand what means these three colors on the Medidenta Genius Proflex files, the new files that we are launching. Actually, you have everything here. It is a night tie, not sterile, the sterilization temperature, single use, all the information you can get on medidenta.com, that is the website. You have everything here that you need. Plus you have the cross section, you have the speed and torque and angles that you want to use. So it is a very complete label. What we did, it was the heat treatment, but we didn't only heat treatment, we customized the heat treatment. So every time that I saw this graphic, these came from metallurgical engineers, and they have this different way of seeing things, right? So I never understood very well the stress and strain and temperature, etc. So I start to study more and more and more and talk with metallurgical engineers as well. And from a clinical perspective, from our dentist perspective, what we need to understand is pretty much this. We have two phases, but we have a transitional phase in the middle. So the austenitic phase, this name comes from Austin, a metallurgical engineer that discovered this phase. The molecules and the atoms, they are in a specific situation. If you see the martensitic situation, the martensitic design, you can see that the molecules are a little bit more loose. So what happens is, in the austenitic phase, this same metal will be more rigid. In the martensitic phase, the metal will be more flexible. That is not exactly the definition, but it's kind of the definition that we need to know. And of course, you can play with these two guys, not 100% rigid, not 100% flexible, but we can play in the transitional phase as well. It depends on what temperature you are working on the oven. So austenitic phase file has this spring back effect. It means that when you make some force in this file, the file goes and the form, it's very flexible, but then goes back to the same position or the original position. In the martensitic phase though, if you have the same force, control memory means that you have a deformation and the file stays deformed, stays in the position, doesn't go back to the original position. That is just a sign for different stages of the metallurgical treatment that you can do in these files. But we have this transitional phase that is awesome. So you can have 10% austenitic, 90% martensitic, or you can have 90% austenitic and 10% martensitic. So playing with different heat treatments, you can acquire, you can get different performances of your file. Of course, if you think, I want big files more flexible, I don't need small files so flexible. Why? Because the design, the metal quantity of these files is less than a big file. And this is kind of obvious. But why I need some kind of heat treatment on these files? Because I need these files to be able to have torsional fatigue resistance. The big files is more cyclic fatigue resistance. It means that a small file, by design, a small file 1504, for example, is more flexible than a big 4004. By design, it's the metal mass of the file. And this is obvious, right? So why I want the same heat treatment for these two guys exactly the same? No, I want a heat treatment for one 1504 that gives me not super flexibility for cyclic fatigue, but much more for torsional fatigue, because these files are the first ones that come to open space in the canal. And the second one, the big ones, I want more cyclic fatigue resistance because these files needs to go in curvatures, and of course, with a big mass, they will suffer a little bit more than the small ones. That's why we came with this proposition. Working small files is one specific heat treatment that gives the purple color for the small files. We have a 50% martensitic austenitic with the blue files, the medium files, 25, the 30, 35, and the large files 40, 50, and 60. We went to more control memory, we went to more flexible files. And that's exactly what we did. So we balance everything, customizing the heat treatment to get exactly the same flexibility of the 2504, the 3504, and the 6004. So everybody will be flexible because the metal mass and because the heat treatment that was customized and you have the same flexibility for all files in the sequence. Okay, so the small files like the 1303, the 1705, and the 2504 will be purple. And the working part is purple. Just to mention that we have different cross sections as well. The glide path files is triangular rhomboidal, and the 2504 is double S to cut a little bit more and helps a little bit more. As you can see, those small files, they are very keen on torsional fatigue. And as you can see in this little video here, I didn't have any problem in putting the 1303, the 1507, and the 2504 in a very 1002 little canal. So as you can see, you don't have any ledging, you don't have any deviation, your deformation on the files. Of course, the large files, we went more martensitic. That's why if you see in the alloy phase expression, you can see the little yellow or gold mark, and the little M here is more martensitic, the little A is more austenitic. The big dudes, you want more flexibility. So if you compare a non-heat treated night-eye file with the Genius Proflex, as you can see, I'm working with the 50, now I'm going to work with the 60 in a curved canal. As you can see here, there's no ledging at all, and there's no deviation, and I can put a K file after that, and I can find my foramen. I cannot find here, you see the big ledge here, but here you not only have non-ledging, you have patency as well. Of course, nobody will use a number 60 in a curved canal, but this is just to mention, just to prove the concept. So that's why you can see in the Genius Proflex set of files, the full set of files, we have two pre-flaring files, two glide path files. We have the 2504 shaping file, 30, 35, 40, 50, and 60 for final shaping. And you can see different colors. So it is in regarding of the metal mass. We customize these files for the metal. Actually, it is the only file in the market that do that, and we have a patent. So that's why you have this little alloy phase expression, little table here, austenitic, martensitic, and of course this is the assorted. So you have purple, you have blue, and gold heat treatments in the same sequence. Okay, so let's finalize just showing a sequence in standard canals. That is pretty much what you have to, what you find in your day-to-day practice. You need just 3 files to do the mesial roots of a lower molar, for example, a bicuspid, upper molar, upper premolar, or the buccal roots of upper molar. Of course, the distal and the palatal, you use large files. You can use, instead of finishing with a 35, you're going to finish with a 40 or even sometimes with a 50. So this is easy. We are going to show, I'm going to show the intro pack, that is the Genius Proflex, 3 files in the package. So the first file is the pre-flaring Curvature Sweetener 2506. It is gold heat treatment, very flexible file. The second one is the 2504. It is purple heat treatment, is more for torsional fatigue. And of course, the 3504 is blue, that is more flexible for cyclic fatigue. So let's see. First of all, we have to do a scouting with a hand file, number 10, for example. So the first file that I will use is my Curvature Sweetener 2506. And the reason that I didn't call this an orifice shaper is the fact that this file goes beyond the curvature. Because it's super flexible, this file can go a little bit inside the curvature and open the second gate. The first gate is the orifice of the canal, the orifice and the entrance of the canal. You have to work in this gate, right? You have to work and you have to enlarge a little bit to be able to put the other files. But the second gate is always the flattened area on the curvature. And this file opened the second gate. So again, I'm using my Curvature Sweetener actually beyond a little bit the curvature. So as you can see in this slide here, my Curvature Sweetener is going a little bit beyond. So I will have, after using this file, I will have 4, max 5 millimeters to do my instrumentation. So pretty much this file do an awesome job, a big job, the bulk of your instrumentation. 2/3 plus of the instrumentation will be done with this file. It has a double S cross section, so this file is very efficient in terms of cutting, and the gold heat treatment gives a lot of flexibility for this file. Another thing is a 19mm file instead of a 21 or 25mm file, and the working part is 14mm. So you have the wire here is 1.0, differently than the normal 2506, that the wire is 1.2. So it's minimally invasive concept here as well. So the first file, as I said, is the Curvature Sweetener, and I will use my ACE, is just go to the System button and choose the Genius Proflex. In rotation, I choose the Genius Proflex Rotary, and of course, I can choose my files just pressing the button File. So as you can see here, I have all the set of files. And of course, when I turn Genius Proflex in the system, the first file is the Autofish Shaper and the Curvature Sweetener. So I use my Curvature Sweetener a little bit beyond the curvature, as I told you. I put my file, I feel resistance, I withdraw a little bit, and I use brushing movements. Not more than 10 seconds. If I get 10 seconds, I remove my file and I will do what? Irrigation. I will use my Sonos polysonic tip. I create this vortex, it's called sonic stream. I will talk about this next time. Now it's time, after I did this pre-enlarging with my Curvature Sweetener or my 2506 19mm, I will use my apex locator to determine my working length. And guess what? The ACE has a built-in apex locator. It means that you can use the motor as a apex locator. Exactly the same cables. You just hook the lip hook, you connect the file clip, and that's it. So we are going to have a special webinar just about apex locator and apical limits. If you want to take a look in one of my papers, Cleaning and Apical Shaping Limits, that I published in Dentistry Today back in 2017. This is very important. Do not do endodontics without rubber dam, period. If you think in doing an endo treatment without the rubber dam, just forget it. Refer, right? If you are not able to put a rubber dam, refer. Don't do it, right? So for an apex locator or for anything, rubber dam, and not only rubber dam, but you have to seal. We like to use the gingival barrier. We have to seal, this is PACDENT's gingival barrier, but we have to seal everything, not only putting the rubber dam. When I talk about apex locator, I will go back to this and some tips about isolation. So to determine the working length, I use a hand file. I put the hand file to the temporary working length. I hook my file connector, and then gently I'm going towards the foramen. When I got 0.0, I put my rubber stop in the position, do some movements, remove the file, and using endo ruler, I will determine my working length. That is the foramen position minus 0.5, minus 1.0. It depends on your technique. Another thing that I have in this motor that is super nice is the Genius Autosense. So I told you that I like reciprocation, but it's not only reciprocation that is a good movement. Reciprocation is a good movement to avoid file fracture during the prospection of the canal. When you come to the point that you have space, rotation is awesome because rotation removes debris. It's kind of an Archimedes pump technique, right? So in rotation, what happens is the file in rotation and the design of the file allows to remove debris, like Archimedes pump effect, removing debris from inside the canal, but you have to have space, right? So if you join the two movements automatically, meaning I start with reciprocation when I need, because the resistance of the walls are pressuring too much and I need safe movement, then I have reciprocation. But when I don't have this pressure, this tension coming from the canal walls, my file is free to do rotation and remove the debris that I'm creating. That is the perfect of the two worlds. So Genius Autosense is exactly that. When I change for Genius Autosense, I don't need to be worried about anything because my file will be in rotation. But if I press a little bit and I have resistance from the walls, my file automatically goes to reciprocation. And will be in reciprocation if I permanently do pressure, will be in reciprocation until I release the file back and goes back to rotation. So in this little movie here, I did one single movement just to show the change from rotary to reciprocation. Genius Autosense, I don't need to do anything but just, you know, do my back and forth and do not a lot of pressure. With my 2504, I'm going to the working length. And of course, after using my file 10 seconds, I will do a lot of washing, a lot of cleaning with my polysonic tip. So this is very important. Do not exceed 10 seconds. If you are doing your instrumentation, 10 seconds later, you don't get the working length, doesn't matter. Do your irrigation 30 seconds with your polysonic tip and sodium chloride, and then go back with your 2504 to the working length. Of course, after that, I will finalize this case with my 3504. That is the minimum enlargement to have a good cleaning. So this is very important, and I will talk about this in our next webinar in July the 9th. But it is important after 10 seconds to use again my polysonic tip with my sodium hypochlorite or EDTA. We are going to talk about the protocol of irrigation next time. If you do this and you put a master cone, the master cone will fit properly. Just an abstract of what we saw. I start with my curvature sweetener to the middle of the curvature, for example. I do a lot of irrigation with my polysonic tip, 30 seconds minimum with my polysonic tip inside the canal. Is at 0.28. So it's very small tip. Just remember, just use the polysonic, activate the polysonic tip inside the canal, never outside the canal. Then I went to turn my working length, of course, and then I went with my 2504, more irrigation, and I finished with my 3504. A mesial buccal, mesial lingual of lower molars canal, for example, or even mesial buccal, distal buccal of upper molars, or even upper premolars, you can do, you can finish with a 35. Others, it depends on you, it depends on the anatomy, but always try to get upper and upper. This is Dr. K. Fabiano, my good friend from Brazil. Thank you very much. I know that you are here with me, with your students in Brazil. Say hi to your students, Dr. Fabiano. Thank you for your friendship and thank you for your expertise. Just look at this case. Amazing. You can barely see the root canal. It's a very calcified canal, very difficult canal. You cannot see the root canals, the final part of the canals. Dr. Fabiano, most probably, I don't know the age of this patient, but most probably is a patient that is an adult, most probably more than 50 years. Most probably more than 60 years, I guess. And there's a very small space, some calcification. Dr. Fabiano went with 3 files. This is the first file, the Curvature Sweetener that he was using. This is the 1705 that he used, and he finalized the case. You can see the canals join. This is so terrible. If you don't pay attention, you can break a file just because the mesial buccal, the mesial lingual are joined together. And if you are not very attentive for this kind of a situation, you can break a file. Again, another view from a very beautiful root canal treatment that Dr. Fabiano did with the Genius Proflex. Another case from Dr. Fabiano, another calcified case. Oh my gosh, just very difficult cases Dr. Fabiano is giving for us. And finalize, oh, beautiful. And as you can see, he knows you have to enlarge to have a good irrigation. That is not irrigation, it's a good washing. And when you wash the canal, you can clean lateral canals, you can clean and you can give a chemical patency for this canal. We have all these files. I show you just 3 files, but we have 2 files, 1 artificial shaper that is flexible as well, but I recommend to use, it's a 3008, recommend to use just up to the curvature. The curvature sweetener is 2506, that you can go a little bit inside the curvature. 2 guide paths, 1303, very little file, 1705, a little bit more tapered file. I love to use the 1705, by the way. It gets exactly the right space for the 2504. These 3 guys here are purple heat treatment. So a more austenitic, a more torsional fatigue resistance for these files. The 2 blue here is the 30 and 35, and the big dudes are the gold files. We have different packages attending to many suggestions from different doctors. Next time, next webinar, what we are going to talk is about how to clean canals with your irrigation. That is, again, I don't like this name irrigation. I like more the washing canals. This is from Dr. Marco Versiani, and he's showing in red here what your file is doing, and of course, after irrigation, what you have to clean the canals. So ADA meaning the animal, ADA meaning is changing the name for SmileCon. We'll be fortunately here in Las Vegas, Nevada, in the Mandalay Bay, that is very close to our facilities here, Medidenta facilities. Will be October 11th to 13th. We will be with 1 booth there, and I will be there to attend the meeting and to, of course, to work with you guys in any question or demonstrations that you need. So next July the 90th, we are going to talk part 2 that will be just about disinfection, irrigation with the polysonic, the sonic stream. We are going to explain the rationale behind everything. We are going to explain the irrigation protocol. When you use sodium chloride, when you use EDTA, when you use distilled water, how much you have to use from the quantity standpoint, how is the time that you have to use, and what is the principles, the science behind that. Is there anybody with any question or any comment?
I have a question, doctor.
Yep, go ahead.
I like to know that these instruments that you offer is there from Medidenta. I am using actually the Genius. I spoke to you several times in the past. You actually give me a lot of insight into the endodontic, and I used your Genius and Genius files at this time. Now the Proflex file that you send me, I didn't use it yet, but the way that you explained to us, I think it's a better way of shaping and cleaning the root canal system. And I really loved it. Thank you so much for all the information first. Secondly, I would like to know how can we get in touch with Medidenta to give us information regarding buying these instruments, and also that the ultrasonic devices as well as the ACE. Is any, and also the second part is any discounts regarding based on your presentation with the Medidenta and how it works, please?
Absolutely, yes. It is a big yes for the 2 questions. You can reach out Medidenta, www.medidenta.com, or you can call Medidenta. You have the phone, right? But I will tell you again is 702-749-8600, or you can go www.medidenta.com and all the files will be there. We have a special discount for this webinar that is amazing. The files are $29.99 a packs of 6. So it's half of the cost of the original Genius. And the reason is that we manufacture the files. So the original Genius were a different perspective from a business perspective was different. We have to import the files from a different manufacturer from Europe. Now we manufacture files, so we are able to give you a way better price and cost on these files. And
Okay.
the same
Yeah.
is with the ACE and the Sonos. And the Apex locator, I didn't talk about the complex because I will talk about the complex. This is a little Apex locator that we have. Of course, we don't have time to talk about everything, but yes, you can. You are going to have a good discount on these files and equipment. Is just say, I'm Dr. Cambis. I did the webinar with Dr. Carlos, and that will be a discount for you.
Okay. Thank you so much, sir. Thank you.
You very much for attending this webinar. Very happy to be here. This is the first step towards our goal, that is to put a nice program to everybody. And I see you next time in the next webinar, July the 9th, right? Thank you very much. Again, thank you for the Medidenta team that put everything together, all this lab, all this educational institute. Thank you very much. We are working hard to make more education, better products in endodontics. And I think that this is just the beginning with the Genius Proflex, the Sonos, the ACE, the Compacts, new tips that is coming. We have a lot of projects that is finalizing for irrigation, for obturation, sealer. Just stay with us, then I will show you properly in the next opportunities that we have. Okay, thank you very much.